Hey everybody, I just want to introduce you now to the respiratory section of our bovine physical exam. And so it's easiest again to start on one side, then move over to the other. Remember, when we're doing our respiratory exam, we want to do both the left and the right side, okay? So with that, we need to know where the lungs are in a cow. And so this is going to be much different than our equine patients. So if we look at the cow, just the caudal border of the scapula, that's going to be the border that in the very cranial part of her lung lobes, okay? The very dorsal part is going to be the transverse processes and the paxial muscles up till the 10th intercostal space. And that's easy to find. We know that there's 13 ribs in a cow, and we can count 12th intercostal, 11th intercostal, 10th intercostal, okay? So her lung is going to end right here, and then we're going to draw that down to the point of the elbow, okay? And then again, we can follow back up on the caudal border of the scapula. What you're going to find here is these lung lobes are much smaller than what we're going to see in our equine patients. So our lung is not going to come back in this in our bovine patients. The rumen is back here, right? We've got this big 55-gallon drum in this area that is going to be full of hay and forage and grain. And so that's going to move everything a little bit farther forward. That's why the respiratory exam in the bovine patient is very, very crucial, because we don't have a lot of lung space that we're going to be doing with. All right. So we have our stethoscope here. Go back to the heart rate, cardiac exam, show you instructions on how to use your stethoscope properly. I'm not going to rehash that, but we're going to put this in here. The biggest thing is you're going to hear pathology in the lungs in different spots. So we want to make sure we're listening to at least 4 different spots. So 1, we're going to move back a little bit caudally. Listen again. Listen a little bit further down. And then we want to make sure that we're always listening down to the very most ventral portion. What's important to know in cows is this is the area where you're going to hear most of your pathology issues. Again, if you hear certain things up here, it's going to tell us something different, all right? So it's important to make sure we're listening for at least 10 to 15 seconds in each one of those spots, okay? And you're going to do the exact same thing on the right side. Again, the borders, everything is going to be the exact same. The next part of our respiratory exam is actually finding out what the respiratory rate of this cow is. So in the normal resting bovine, it's going to be 12 to 36 breaths per minute. But again, these are just book values, and in the bovine, they can be wildly different, okay? So one of the things that's important to remember is cows cool themselves just like a dog by panting. So if this cow is hot, she's going to be breathing faster. That doesn't mean anything's wrong with her. She's just trying to cool herself down, and that most likely will put those values outside of what that normal range is. We can see respiratory rates in normal cattle 60, 70, and there's nothing pathologically wrong with that cow. So if you do get a number different from that value, just remember that. What I like to do when doing respiratory rate, there's a few options. Probably the least accurate is actually using our stethoscope, all right? Normally, we're not going to hear a lot of sounds in the lungs on a normal cow. So I don't like doing that. What I like to do is actually come to the back of this cow, and if you look at it directly from behind, you can go on this right flank area right here, and you can actually watch this cow breathe, okay? And you can see her taking breaths. So after we've watched the breaths on the cow in the flank area, one last spot that we can actually do is come up to the nose of the cow. And I know it sounds very, very basic, but we can actually just feel the breaths coming out of this cow's nose, all right? And so that's another, again, accurate way. Last part of the respiratory exam is actually coming down and palpating the trachea, all right? Again, we want to make sure we're doing this in a safe area. And You can see the way she's got her head stuck through here. Actually would need to step around to the back side, all right? But what we want to do is take your hand, rub it up and down the trachea, all right, and see if the cow actually coughs, all right? So that completes our respiratory exam of the bovine patient.